want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Joining us right now is Dr. Leanne J. Webb. She's assistant professor of emergency medicine at the University of Virginia School of Medicine. And so certainly glad we're here. First, Dr. Webb, I just want to give our condolences to your friend, of course, the emergency room doctor out of New York, who passed away earlier this week. And so it's certainly been very tough for so many of doctors having to deal with this. And we've been hearing, we've had them on the show, and we're hearing from medical people who were just overwhelmed with the onslaught of what's happening around this country, and it's actually not slowing down. Part of the scare is that we're not doing enough testing, so everybody's like, this thing could easily ramp up that quickly.
Yeah, I think you're absolutely right. Thank you for the condolences. What I will say about Dr. Breen was that she was a wonderful medical director, which is basically my direct supervisor or boss when I was working at New York Presbyterian, the Allen Hospital. And she really was a fierce and passionate advocate, both for the physicians that worked under her as well as the patients. I have many great stories about her being an advocate for patients, and she will always, in our minds, be a hero. Yeah, we're mourning her loss in a really heavy way. So in terms of the testing, we have not tested enough people yet. And so, there's a lot of talk about reopening the economy. But what we know is that there have been certain guidelines set forth, some of them by the White House Task Force, some of them by the CDC. And what we ultimately know is that these are only guidelines, right? And so our Constitution is not set up so that at the federal level, they hold all of the control over what's going on from a public health standpoint. So they've issued these guidelines, and the states take it upon themselves to follow the guidelines or to not follow the guidelines. And in many cases, there are states actually skipping steps here in this phase approach to reopening, and that's very concerning. Particularly, what we need from a public health standpoint to break this transmission chain is, one, we need widespread testing, and we need retesting as well. Like, we need to be able to retest people. Two, we need to be able to take those sick people and isolate them in an effective manner. We need to quarantine our sick people, and then we need enough infrastructure to actually complete the contact tracing in a meaningful way so that we can also tell those people to self-isolate, right? And so that's the basic of breaking the transmission chain of coronavirus. I understand the economic arguments. I really do. I went to business school. I understand on another level that people are suffering, including a lot of people that I know. But I do feel like in this instance, health has to come first.
Well, because look, you can have all the job you want to, but if you are sick, and then all of a sudden if you're dying, and then now you got to pay for funerals and all of that, it doesn't matter. You're a business owner like myself. You don't have a business if your workforce is out in the hospital trying to recuperate.
Absolutely. And this is the other thing about it. Some of these guidelines are not practical. So if you look at the CDC and the draft that they put it out specifically for certain groups, including for schools and for businesses that have vulnerable populations or vulnerable people working for them. In the school guidelines, it has things like keep the desks 6 feet apart. What classrooms do you know of that can really effectively
right
desks 6 feet apart?
Which now means that you probably are going to be cutting classrooms in half. So now what happens to those other students?
Yeah, so a lot of those things aren't thought through. There's another section in there which talks about what to do for employers if you have employees who are vulnerable, right? And so if you look at the employees who are vulnerable, one, they would have to raise their hands and say, hey, I'm vulnerable. What does that do in terms of discriminating against people, right, in the workplace? That's one issue. And the other thing, if you look at the specifics of the CDC's draft, is that they say if your employee, for instance, rides public transportation to work, they should be encouraged to telecommute at home. But we know, unless you're living in a place like New York City where everyone pretty much uses public transit. If you're somewhere else and you're using public transportation, 9 times out of 10, it's because you can't afford that car to get you to work. And 9 times out of 10, you're a frontline or essential worker who's getting lower pay. And you probably won't be able to telecommute from home. So some of the guidelines just aren't practical. So it's just unfortunate.
Let's see here. Questions from our panelists. Robert first, then Rob.
Absolutely. And I want to thank you so much for all the work that you and all the other medical professionals are doing. For people who are in states such as Georgia, where I am, and who are going to be going back to work and not following the guidelines as the state has set out, we haven't had 2 weeks of reducing numbers. Actually, the numbers are increasing day by day, even now, but we're reopening our economy. What will be your advice to workers who have no choice but to go back to work or lose their job? And as far as protecting themselves and making sure that they can step in where the government is not providing that leadership?
Yeah, so I think that's a really important point, and that kind of speaks back to what I was saying before, like states are actually skipping these guidelines. In phase one, there's sort of a gateway criteria that the government has put out on the federal level that says that essentially the data has to be downtrending in terms of the number of new cases and deaths and actually the number of people who are tested as well. So the surveillance, those numbers need to be downtrending for 14 days. That's what it says. And some people are skipping that. So for the worker who is forced to go to work, essentially, I'm sorry. I apologize in advance. That is not a good position for you from a health standpoint. The things you can do would be the things that we're already pushing right now. So social distancing, which is also part of the guidelines that the government has released. So making sure you're at least 6 feet away if you can. However, we know that that's not really practical. Making sure you wear something that is cloth, so a mask, a scarf, some type of clothing that is covering your face and not just your mouth, because we're seeing a lot of people. I personally am seeing a lot of people out right now where they might have a mask on, but it's actually here. So it's not actually covering their nose. It needs to be covering your nose and it needs to be covering your mask. It needs, or your mouth rather. It needs to be washable. So if you're wearing this to work every day, you need to go home and wash it every day or have multiple masks that you can actually switch out. You really need to have a serious conversation with your employer about all of the ways that you are being protected when you go back to work. And I do think that there's something that some of these non-essential businesses can learn from the essential businesses who are doing it right, but they will have to find those businesses. The employers will have to seek out those businesses locally.
Rob?
Yeah, I have one question. I have 2 comments before that, just based upon what you said, Dr. Webb. 2 things. When you look at the economics of the situation, as you mentioned, and it's hard for people that don't have jobs, I actually think that's because of our lack of our government's response. Other governments don't have that. We haven't had, as I said, 30 million layoffs in Britain, for example, where they're taking care of about 75% of the wages and directly giving businesses money for that. So I think the answer to that is, if people can't work because of health reason, that's where we're supposed to have government. But this is by design because we have an ineffective government. 2, when you talk about essential workers, there's a general strike today. I would be remiss if I didn't bring that up, with Amazon and many others that are out there that are our essential workers that are doing the work that we all like. There's all these popular commercials because the data says it's nice to thank people, but at the end of the day, it's good to pay your workers. So with that, you have workers that, let's say you have some of these essential workers or now non-essential workers that are coming back out and they get COVID-19, what would you advise them? Because I know there's some new laws in terms of how they go about approaching their employer.
Yeah, so the first thing that they need to do is really contact their primary care doctor or reach out for medical help if they have issues surrounding COVID-19. Those people should definitely not go to, I say this as a health professional, knowing that some people feel like they're forced to go to work, but they should not be going to work. So if they're having a fever or cough or body aches, a sore throat, if they're sick at all and they're concerned that they could have COVID-19, those people should not be going to work. I hesitate to give sort of broad advice about what to say to your employer specifically. There are some protections in place for some businesses so that people can have paid medical leave. Now, I don't know what that looks like going forwards once people actually open up more of the economy. Supposedly about 35 states will be either fully open or partially open by the end of this week. And so that's a personal conversation to be had with employers, and probably need to get some lawyers involved as well. But definitely they should not be going to work if they feel sick.
All right, then. Well, Dr. Leanne J. Webb, we certainly appreciate it. Thank you so very much. Hopefully, people will listen to the health experts and not the nuts in the White House who don't actually care about people's health, especially considering all Donald Trump has done has been 3 years trying to destroy the Affordable Care Act. So we appreciate it. Thanks a lot.
Yep, thank you so much.
All right, then. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he's the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist. Dr. Georges Benjamin, executive director of the American Public Health Association. Malcolm Nance, family medicine physician, Dr. Jen Caudle. Dr. Tashaka Cunningham, a molecular biologist. Kat Stafford, she's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University. Congresswoman Yvette Clarke from the state of New York. William Springs, AFL-CIO economist. Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she's a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the group. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Folks at Fox News, they're just quite genius, okay, because, they just love to talk about what's going on here. So before I play for you what Dr. Phil said, so check this out. So Dr. Anthony Fauci was on Laura Ingram's show, and if y'all want to see how she is not the brightest bulb in a dark room, listen to this idiotic question and just watch the facial response of Dr. Fauci. Folks, go right to it here.
Area where you have very few people.
Question of a vaccine.
Hold
on one second. Come back to me. Come back to me. All right. So let me go ahead and clear some audio here. There are a couple of things that are going. This is, first of all, when you see this video, I saw it and And if you want to understand why these nuts are running around the country holding these protests, it's because they're watching Fox News and they are literally feeding these nuts. And if y'all just want to kill yourselves, go right ahead. But that's pretty much what y'all doing. Okay, here we go. Check this out.
Dr. Fauci, on the question of a vaccine, we don't have a vaccine for SARS. I mean, they got close in mice. We don't have a vaccine for HIV. And life did go on, right? So the idea that we're definitely going to have a vaccine, we didn't really approach much else in the same way as we're pegging going back to normal with a vaccine, did we?
Well, no, but Laura, this is different. HIV/AIDS is entirely different. We don't have a vaccine for HIV/AIDS, but we have spectacularly effective treatment. People who invariably would have died years ago right now are leading essentially normal lives. SARS is a different story. SARS disappeared. We developed a vaccine. We were in the process of going through the various phases. We showed it was safe. We showed it induced a good response. And then SARS disappeared. And we didn't need to develop a vaccine for SARS. So I think it's a little bit misleading maybe to compare what we're going through now with HIV or SARS. They're really different.
But we don't know. This could disappear. I mean, SARS did pretty much disappear. This could as well, correct?
Yeah. You know, anything could, Laura, but I have to tell you, the degree of efficiency of transmissibility of this is really unprecedented in anything that I've seen. It's an extraordinarily efficient virus in transmitting from one person to another. Those kind of viruses don't just disappear.
Okay.
Then the next night, they called Dr. Phil. Y'all go ahead.
250 people a year die from poverty. And the poverty line is getting such that more and more people are going to fall below that because the economy is crashing around us. And they're doing that because people are dying from the coronavirus. I get that. But look, the fact of the matter is we have people dying. 45,000 people a year die from automobile accidents, 480,000 from cigarettes, 360,000 a year from swimming pools. But we don't shut the country down for that. But yet we're doing it for this. And the fallout is going to last for years because people's lives are being destroyed.
And
Y'all also, Law and Victoria Burke, National Newspaper Publishers Association. Chris, what the hell? 2 weeks later, what the hell is wrong with these people?
Well, first of all, the comparison is just simply ridiculous. I mean, one of the things that I do is I own a number of medical companies. We do COVID testing every day. If you look at the virology of this, it is not, that is like comparing apples to eggs here. That is simply not a valid comparison. And then to have doctors, I'm not sure why Dr. Phil was...
Dr. Drew, and then Dr. Drew screws up, he got to apologize. Saying, well, here are extra Americans who died because of cigarettes. I don't smoke.
Those are false. Those are false truths.
But I can die of coronavirus.
Yeah, those are simply false choices. Look, if you want to have a discussion about the economy, have those discussions. If you want to have a conversation about craziness, you can talk to Dr. Phil about that. But when you're talking about science here, and when you're talking about biology here, those are simply not the appropriate guests in a situation like that. Because what it further does, and this is the problem that we're finding, what it further does is it simply confuses the process.
Yeah, it does. And that, Tiffany, is why you got these idiots in Michigan who are protesting with their Trump flags and their Confederate flags. Those seem to go together. And all this sort of stuff. They actually blocked an ambulance. They actually blocked an ambulance from being able to do the work. Then I'm talking to my parents today, and this dumbass woman in Texas, I don't care if I catch coronavirus. I don't care if I die. I want my liberty. Your ass ain't got no liberty or no freedom if you dead. The governor of Michigan, Tiffany, said, take your pick. You want 6 feet apart or 6 feet under?
That's the two options that you have. Let's be very clear, Roland. As of right now, nobody should be calling him Dr. Phil anymore. His name is Phil. He has been removed from his title and privileges of being called doctor. That's number one. Number two is, if we pay attention to the dog whistling in his comments, he said folks die from poverty and folks are dying from coronavirus. And the folks who are mostly impacted by both of those issues are poor people and people of color. Dr. Phil, I looked it up when you were playing the tape. His salary is $80 million and his net worth is $440 million. He ain't got to worry about neither one of those issues. But poor people and people of color do. And so for him to have the mental strength to come on TV and say, this is not a big deal, it's just like poverty. Poor people die from poverty all the time, and people die from coronavirus, goes to show you not only his white privilege, but also we are removing his title as doctor, period. Our folks need to take this seriously. Roland, my mother has been let off from both of her jobs and lives in Los Angeles, California. There are 22 million people who have lost their job because of this, and folks are taking it seriously. Now, back to what you said really quickly about Donald Trump and Governor Cuomo. It looks like two parents who separated, who are not trying to take responsibility for their kids, but still have to do their job and do the work to take care of the people that they serve. And this is why elections in November are so important, because at the end of the day, the folks who are making the decisions about the stimulus packages, our health care, our schools shutting down, our jobs, your $1,200 check that you're going to get with Donald Trump's name on it, et cetera, all of that is coming from people that we are voting for or that we choose not to vote for. And that's why November is so important. And we got to remove Donald Trump from office.
But Lauren, I'm just, so now all of a sudden, Phil worries about the poverty? Now all of a sudden, there's a concern? And somebody might be who's watching, and I'm looking at your comments on Facebook, YouTube, Periscope. You know, oh, that's Fox News. Y'all, but here's the problem. This is even broader. It's so many in conservative media. Michael Savage, okay, you will never, ever in your life hear me say anything positive about Michael Savage. But I'm reading the New York Times, Lauren, and Michael Savage is going, y'all are idiots listening to Sean Hannity, who he mockingly calls Dr. Hannity, and Dr. Limbaugh. Why? Because Michael Savage, even though he's a nut, has a PhD and studied epidemiology.
Right.
He's been screaming, y'all, this thing is real. But you have conservative media who is just waving a flag, oh, this is blown out of proportion. And the problem is, Lauren, they are talking to lawmakers and governors and state reps and state senators and members of Congress and business leaders, and they're listening to these nuts.
Yeah, well, what's actually going on here is just the Fox News game of protecting Donald Trump. And the reason that, of course, Trump doesn't want to do more testing is he doesn't want to find out that the numbers are bigger than they actually are. The reason that you have Dr. Phil somehow sitting there crossing Dr. Fauci is they're trying to message it's no big deal, it's no big deal, it's no big deal. And they're also trying to message that, of course, closing our businesses and closing down our way of life is something that somehow is a decision that is hurting Trump, but is made by other people. That's why you have all this stuff about the governors. So, as Tiffany just said, it's like 22 million people filing for unemployment. We have 110,000 businesses that are going out of business as we speak. But this is all messaging. It's all PR. It's all following the Pied Piper of Donald Trump down the road to nowhere because he is doing PR. He is not doing public policy. He's not interested in public policy. The people he hires in the White House are not interested in public policy. They're interested in getting past the next PR moment, and they're in huge trouble. I think, frankly, I will be absolutely shocked if he wins this election. This entire thing is him. It's him not reading his intel report in January and talking about vaping Okay, it's him not preparing the country for this pandemic. He can't blame it on anybody else. And no amount of PR and no amount of dancing around is going to change that, because now we have, 35,000 people dead in a month. And all because we weren't prepared, because we didn't prepare early enough, because he wanted to fool around and act like this was no big deal. Them acting like it's no big deal is their attempt to try to save Donald Trump from the inevitable reality that nobody is going to ignore at the end of this, when we end up with 50 or 60,000 people in the end dead because of COVID.
Every single night. We've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Cardle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the Root. The Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Okay, folks, white people are losing their damn minds. They're losing their minds. Y'all see all these dumbasses running around these states, sitting here protesting, pulling their guns out, Confederate flag, talking about we need to get back, open these states, damn it. I don't know what's wrong with these people, as if we do not have a major pandemic that's actually going on. Now, joining me right now to talk about his latest article for Medium.com, Pandemicking While White, is anti-racism educator Tim Wise. Tim, glad to have you on Roland Martin Unfiltered.
Thanks, man. Thanks for having me.
All right, so what's up? Pandemicking While White, explain.
I just love that I'm the white person explainer for the show. I love that.
Yeah, well, look, when I was on CNN, I was the black explainer.
I know white people. So let me sort of walk you through it. I think there are a few things, right? Number one is, as I talk about in the piece, that, when you are and have been essentially the privileged and dominant group, and you really don't face oppression, and you really don't face systemic injustice. I'm not saying white folks don't have challenges, but don't face oppression. I guess it becomes very easy for you to think that a stay-at-home order, and it's not even an order in most places, it's a strong recommendation, that is somehow tyranny, right? That's the heavy hand of the state, totalitarianism, fascism. That's a real privileged mentality, right? Black and brown folks know that tyranny looks a little different than that. Tyranny is getting, shot, John Crawford in the Walmart. Tyranny is Tamir Rice being shot in the park in Cleveland. Tyranny is police brutality and racial profiling, children in cages, deportations. But when you're white, apparently, when you look at some of these protests in Michigan and Ohio, et cetera, and you have folks standing out there with signs, not ironic signs, but legit signs that say, I want a haircut, or talking about, I want to be able to get seeds to plant flowers in my garden because it's spring and Governor Whitmer is making where I can't do that. If you think that that's oppression, right, your life is awfully sweet. So it's a very interesting insight into the way privilege functions, even in the midst of a pandemic, when millions of white folks are getting sick and thousands have died, but we still have the privilege of thinking that this lockdown, which is about protecting lives, is tyranny. So you had Stephen Moore, the economist and Trump ally, who said that these protesters are the modern day Rosa Parks, right? Comparing
in fact,
protesting tyranny to protesting orders to try to keep people alive. It's fascinating.
In fact, I'm trying to pull that up right now because, first of all, we know how much of a joke Stephen Miller is. And so let me go ahead and see if I can pull this up. Folks, go to my iPad, please. So what Tim is talking about, Stephen Moore, economist, he gave numerous interviews last week, and this is what he had to say.
We're going to see a lot more of those. In Ohio, we saw more protests today. I'm working with a group in Wisconsin that wants to do a drive-in. So, you remember the old sit-ins, but this is going to be a drive-in. They're going to shut down the Capitol. Shh, don't tell anybody. But they think they can get 1,500 people to come in. And this is great. You guys will. So we have one big donor in Wisconsin. I'm not going to mention his name. And I told him about this. He said, Steve, I promise I will pay the bail and legal fees for anyone who gets arrested. So this is a great time, gentlemen and ladies, for civil disobedience. We need to be the Rosa Parks here and protest against these government injustices.
I've asked. I mean, Tim, really? We need to be like Rosa Parks? Really?
Well, it's like I said in the piece, it's very hard to top that. But the Whiteness Olympics, look, they never get canceled, Roland. It's not like the Olympics 2020. The Whiteness Olympics are always going, and there's always competition for gold. And so about a day or two after that interview that Stephen Moore gave, there was a state lawmaker in Idaho, who I mentioned in the piece, who is from, she's a Republican from Uzbekistan, clearly Idaho, that portion of the state. And she made the comment that, when you say certain jobs are non-essential, that's just like Nazi Germany. When they said people were non-essential, they put them on trains, as if those of us who want to shelter in place are advocating that we take, all the people in the vape shops and the Pilates studios and send them to Auschwitz. I mean, it's just such an incredible lack of perspective, which again speaks to the relatively privileged position that white folks are coming from. It's the same as the Tea Party stuff. These were folks, a lot of them the same people, who a decade ago were protesting affordable health care because they didn't want to get health care from the black guy. And they didn't want to get health care if they were going to be on the same program that some black folks might be on. So they would rather die. And they made that rather clear. And and at that time, if you'll recall, what's fascinating, they were out there saying, well, we're against Obamacare because they're going to let old people die because it'll be too costly to keep them alive. But they're now saying that we need to let old people die so we can get the economy back up. So, I mean, as I said in the piece, America is on some white stuff. I didn't say stuff in the piece, but America is on some white stuff, and it's deadly.
Remember, Tim, my show's called Unfiltered. We're good.
Oh, we're on some white shit, then. We're on some white shit, and these protests are a good example of the dangers of whiteness, not just to people of color, which folks of color know. I'm talking about the dangers of whiteness to these white people. You got a guy in Ohio that was one of the main guys talking about this is all a hoax, it's all BS, Governor DeWine, all these people are overreacting, and he died.
Right, his ass
he's
dead.
Not the only one.
One of the first guys, preacher, I think it was in Wyoming, his ass dead. There was a fool in Louisiana, Shreveport, his ass dead. And I'm sitting there going, y'all, matter of fact, it was. I love. It was a person. In fact, there was some white woman. I wish I could find the tweet. It was some white woman was losing her mind on Facebook, and then this is just a joke. Don't believe this. Big time Trump supporter. Then a few days later, her family post a GoFundMe to pay for her funeral expenses because she's dead.
Right. And what's sad about this is we're being given this false choice. You either go back to work and risk your life, or you stay at home and the economy crashes. There are other ways of doing this. We could, if we really cared about people as opposed to our economic orthodoxy that white conservatives in particular are so bought into, we could do something different. Denmark right now is paying people the equivalent of $50,000 US dollars per person to just stay home, stay healthy, and then shut the economy down until this thing is done. But in this country, we are so slavishly devoted to the idea of the unfettered free market and hyper-capitalism that the idea is, no, we got to go back to work. We got to go back to work. And there is another alternative here that we're just not wanting to investigate. And the people who are running this thing clearly, are more and willing to embrace a eugenic mentality that says certain people are disposable. The rally here in Tennessee, where I live, yesterday or 2 days ago, there's a woman with a sign that says, "Sacrifice the weak, reopen Tennessee." I mean, that's the kind of thing that if someone on the left or someone of color were ever to have a sign that said something like that, or to show up at the Capitol with guns strapped to the teeth, as these folks in Michigan did, we know what would happen to them. We know how they would be viewed. They would not be viewed as patriotic, liberty-loving Americans. They would be viewed as insurrectionaries. They would be arrested. They would be shot. They would be gassed. And the president wouldn't be signal boosting them on Twitter. So this is about a soft civil war, as people have talked about. This is about attempting to use mass death as a wedge issue in a culture war that this president wants to wage on behalf of whiteness. And that's what this is.
And that's exactly what you're dealing with. You're dealing with somebody who is trying to gin up his white base. I got to read this comment. Got to get your thoughts when you talk about the craziness of whiteness. You have... from my home state, one of the most idiotic, asinine individuals. Look, I keep saying that the three dumbest governors are Brian Kemp of Georgia, Ron DeSantis of Florida, and Tate Reeves of Mississippi. The fighting those three for dumbest elected official is Dan Patrick. Okay, a crazy, deranged right-winger. I used to debate Dan when he was a conservative radio talk show host on the NBC affiliate. He is, I would dare say, 100 times crazier. This is what this fool said last night on Tucker Carlson's show. When because previously he was talking about, we shouldn't, some of us should accept dying for the future of our kids. He said, quote, "What I said when I was with you that night," go to my iPad, Henry, "there are more important things than living. And that is saving this country for my children and my grandchildren and saving this country for all of us. I don't want to die. Nobody wants to die, but we've got to take some risk and get back in the game and get this country back up and running." Okay, but I'm going to deal with this quote. Tim, there are more important things than living.
Right. Right. Well, let's just be very clear. It's it's because of the lives that are mostly at risk that he says that. I said this last week on Twitter. If COVID-19 was affecting disproportionately white, disproportionately, healthy, disproportionately prime of life, disproportionately evangelical Christian folks for some reason. Let's say this virus had a thing out for white folks or evangelical white Christians or whatever. If it was killing, or if it was just even killing disproportionately people in the prime of their lives, the way, for instance, the 1918 flu did. It was a weird thing. It actually affected young people more than old people. If COVID was doing that, none of these people who are saying, well, sacrifices have to be made and maybe some folks have to die, but it's the American way, they wouldn't be saying that. The reason that Patrick and others are willing to say that is precisely because the people who were disproportionately affected are working class and people of color and people who were already sick. So this is the eugenic mentality of, historically of all fascists. It's the eugenic mentality that animated this country in the late 1800s, early 1900s, from which Hitler borrowed. It's that same mentality. There's certain life worth living, and we will protect them at all costs. But others, they're marginal and they can be sacrificed. That's the only reason he's saying that. If this was disproportionately affecting people like him or younger than him, people in their 30s, let's say, or 40s who were white and middle class or above, he would never say that. And these folks wouldn't be out protesting at state capitals with guns.
And also, I take it that you certainly agree that Donald Trump, he needs aggrieved, angry, we have no idea what's going on with white folks in order for him to beat Joe Biden in November.
Yeah, it's the only hope that he has. And it's a calculated gamble on his part, because if things get opened back up and there's a huge uptick in illnesses, obviously a lot of that is going to hurt him politically. But he probably figures, well, I got no choice. My economy is in the tank now. The only thing I can do is take the chance. And if people die, I'll try to blame the governors. I mean, but this is all about his politics. This is about a guy and about a movement that has, as we've been saying, lots of us for a while, but it's more and more evident. It is a death cult. It is people that are willing to drink the Kool-Aid, just like folks with Jim Jones, walk off the cliff like lemmings on behalf of their dear leader. There's no philosophy behind this. Look at the signs at these rallies. They're all over the place. You got anti-vaxxers, you got the QAnon nut jobs, you got the people that just, Jesus is my vaccine. You got people that have signs about every possible cause under the sun. There's no coherent philosophy. The coherent philosophy here is this conspiratorial, they're all out to get Donald Trump and we must support him. This is cult behavior, and we don't have any obligation to be respectful to these people, to talk nicely about them. Our only obligation is to defeat them mercilessly every time we get the chance.
Tim Wise, we certainly appreciate it. Thanks a lot.
You bet, man. Thank you.
All right. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Cardle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Springs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep, health and wellness specialist Dr. Yolanda Hancock, Desmond Meade, president of the Florida Rights Restoration Coalition, Cliff Albright, who is the co-founder of Black Voters Matter, Michael Harriet with the Root, Mina McWhorter, founder of Love by the Hand, Dr. Julian Malvo, economist, president, emerita Bennett College, coroner Michael Fowler, is the mayor of Atlanta, Keisha Lance Bottoms, mental health therapist Suzette Clark, Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr., Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District, Dr. Leon Madugal, president-elect of the National Medical Association, Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. All right, folks are getting their stimulus checks in the mail, $1,200, $2,400 for those filing jointly, $500 for each qualifying dependent child. Crucial dollars for lots of people. Obviously, it's not enough. So what do you do with it? But also, how do you deal with your finances that are now in total disarray because of the coronavirus epidemic? Joining us right now is financial expert Lynn Richardson. Lynn, glad to have you on the show. How you doing?
Hey, Roland, I'm so happy to be here. Thank you so much for having me.
All right, checks are rolling in. So what do you tell people what to do? Pay all their bills off or hold that cash?
Hold the cash. Keep as much cash as you can. Well, the first thing is to get in proper order. Many of the mortgage companies, all federal government mortgages, VA mortgages, FHA mortgages, mortgages backed by Fannie Mae and Freddie Mac are all on hiatus. So people should not feel ashamed because everybody has either had a money problem, is having a money problem, or will have a money problem at some time in the future. Call your lender. Get the 6-month extension, the 3-month extension. Get whatever they have available that is penalty free. Get it. Call your car company. Call your credit card companies. Call all of your lenders and get whatever extensions they are offering, because we know that the stimulus checks are not enough. The minimum salary, the median salary for a family is roughly $900 per week. That's about $3,600 a month. So the $2,500 one-time stimulus, we know, is not enough. So I'm encouraging people to keep their cash and then to be wise with the rest. There are two things right now that are important: your health and your wealth. Once your health is intact, then you want to take care of your wealth. And everybody must spend less money, get more money. If you don't have a job, your job is to get a job. If you have a job, your job is to get a job. And which job am I talking about? Your home-based business. Because when you have a home-based business, then you can do number 3, which is get your money back by having access to over 475 tax deductions. So I want people to keep their cash rolling.
All right, so you got that. You got the stimulus check. But now moving forward. Look, we don't know how far this is going to go. Most of these people are talking about working with people through May, June, maybe July. We're now about to operate in a much longer period here. And so what must folks be doing when it comes to making adjustments? You know, what happens if they don't suspend mortgage payments? They don't suspend car payments. They don't suspend insurance payments. What do I do?
Yeah. So that's why right now, during the season that we have, because you're absolutely right, we don't know how long these extensions are going to go. We don't know if they're going to we do know that student loans are suspended for quite some time, but we don't know how long it's going to take. And more importantly, there are people who are at home who are not going to go back to work because the world has figured out how to work with people at home. So they're not just going to start hiring people. So what people have to do is to literally cut every single possible unnecessary expense. I was born and raised in Chicago. We grew up on bologna and cheese, peanut butter and jelly, grilled cheese, or a bowl of cereal. So, keep your budgets as low as possible. Get rid of the additional subscriptions that you don't need. Ensure that you are tracking every single possible penny. But what I'm going to say, Roland, and I feel like Noah, he said it was going to rain. Nobody believed him. Everybody was laughing. And then the world was full of water. I've been saying for 12 years, everybody should get a home-based business. And right now is the time to ask for all the relief you can, apply for everything, because also when you have a home-based business, I'm talking about self-employed people, and you don't have to go file anything anywhere. I'm talking about DJs, babysitters, housekeepers, hairstylists. If you're a self-employed person, you can also apply for the business relief, because that's where the money is. With the Paycheck Protection Program, the EIDL is depleted, but they're giving money out through the Paycheck Protection Program every single day. I'm seeing hundreds, thousands of people who are sole proprietors, truck drivers, Mary Kay consultants, Uber drivers. So I really want people to cut back on everything possible. They're telling us we can go outside, but we need to stay at home. Because when you go outside, you have to spend some money. So stay home, spend as little money as you can, have a frugal diet, because Whole Foods is taking your whole check, have a frugal diet, and start a home-based business. And also apply for any relief if you already had a home-based business.
Okay, and so with that, so when you say home-based business, somebody is watching right now, people are sitting here, they're on YouTube, Facebook, and Periscope saying, what the hell is she talking about? What business?
Yeah. So do you cook for anybody and get paid? Do you tutor for anybody? Do you anything that you do? I say everybody can have a home-based business, being a consultant, doing something. This is low-risk services. So you would not have a home-based business as a dentist. You need a license, a building, you need all kind of stuff for that. You would not have a home-based business as a surgeon, but you'd have a home-based business as a tutor. What if you were teaching during the day? You can tutor from your home-based business. You can have a virtual assistant. I know so many people who are administrative assistants, executives who could have a virtual assistant business. People who are doing, one lady, she lost her flower shop. I said, listen, you are in the business of bringing joy. So now that you're not delivering flowers and nobody will even produce the flowers for you to deliver, how many other ways can you bring joy? There's other ways to bring joy to people than a flower shop. So I really encourage people. In my book, The Symphony, A Guide to Creating and Balancing Multiple Streams of Income, I talk about this. Now, I don't want you to be like Lenny and I Got Plenty, from Good Times. You selling lighters and socks. But at the same time, you want to have a symphony. You want all of your businesses to work together. And I think everybody has something in them that if they just pull it out, it could be a world-class business. So really, we don't have any other choice. We have to ask for the extensions. We've got to minimize our expenses, and we have to be in the business of getting a job. And that includes our own job with our own home-based business. Okay.
And so with that said, what must they prepare to even do that? Because that's not just, okay, I'm going to set it up.
Yeah, no, this is good. So here's the deal. If you want a home-based business, you already have everything you need. One, you have your name. Okay. Now I am going to tell you something. I am living proof that this works. I applied for the business assistance that the CARES Act is providing because we know that the stimulus checks for a husband and a wife and a child, that's not enough money. But with the business stimulus, you can get access to up to $10 million. So I applied as a sole proprietor. I use my name and my social security number. There's no LLC involved. There's no corporation involved. There's no employer identification number involved. Just your name. So the government, for the first time in history, has said that freelancers, what do you do for freelance? Now, so anybody who works and gets cash, or anybody who works and gets a 1099 is technically a self-employed independent contractor or 1099 employee, which ultimately is a home-based business. So a home-based business literally means that your home is your principal place of business. It doesn't mean all the activity happens there. You could have a home-based business as a babysitter, but you have to go someplace else to babysit. You have a home-based business, you're a truck driver, but you have to go get in the truck and drive. It simply means you do not have a building. Like a dance teacher who dances and goes everywhere, she has a home-based business. But if she has a building, a dance school, that's no longer a home-based business. So I'm encouraging everybody This isn't the easy way. This is the IRS way. The IRS has given you permission to not only have a home-based business, but the IRS then says, guess what? We'll give you your money back. What do I mean by give you your money back? Well, let's just say, for example, you went to the grocery store, spent $200 on groceries, ate your food, and then next week the grocery store manager said, hey, come back and get your money. Well, that's what the IRS says. The IRS says if you run your home-based business like a business, and remember, that's any business. You could be a DJ, a hairstylist, do eyelashes, bake cakes, do hair, braid hair. All the businesses that people do that they don't realize they have so much power in. The IRS says if you run that business like a business and you document your expenses, then you can use your cell phone and I'll give you your money back. You can drive your car and I'll give you your money back. So the reason I'm speaking about this, Roland, is because what we have to realize is we actually do have power. It may seem really powerless now, like everything shut down, your job ended, you don't know where you're going to get money from, your bills are coming, but there's something that you can plan. Because see, if you fail to plan, then you are planning to fail. And this is going to put more money in your pocket down the long run. So there's a couple of ways that we can increase cash flow. One is through passive streams of income. If you don't already have them coming in, they're not going to come in today. Two is to literally go and get more side jobs, including a home-based business. And three is to get your money back. See, that's the missing piece, because if you simply make more money, everybody knows that the more you make, the more the IRS will take. The more you make, the more the IRS will take. So you have to include getting your money back. And so that means my brothers and sisters, the mechanic in the alley, he has a home-based business. I used to go take my car to the mechanic around the block. He put my battery in for $40 instead of $400. That's a home-based business. So the key is you got to report the income. Put your income in your bank account. If you have or haven't been doing that, but you know you've been in business, then you have options. And if you haven't been in business, then I want you to start a home-based business. Everybody has to have a home-based business. People wonder why Warren Buffett pays less taxes. Why Jeff Bezos, the world's richest man, he had a $160 billion tax refund. Let me tell you something. The wealthy rich are operating by a whole different game. People want to know why our president, we can't see his tax return. I don't think it's illegal. I think it's perfectly legal. And I think it's
well, first of all, we know exactly
write off
we
taxes.
know exactly why he won't see those tax returns. No, because he's going to show how he's used every trick in the book to cut down on his taxes, and that's why he's trying to do it. Lynn, tell people about your website and your book.
Go to LynnRichardson.com or go to AskLynn.org. Go to AskLynn.org, submit your inquiry where you get a whole bunch of answers. If you really want to go to the next level right now, my book, The Symphony, A Guide to Creating and Balancing Multiple Streams of Income, will tell you how to get to the next level. And my book, Living Check to Monday, The Real Deal About Money, Credit, and Financial Security, will help you get out of a financial rut. It'll teach you how to budget, which people don't like the word, so I say schedule. And it'll teach you how to develop new money habits so that if this ever happens again, then you'll be ready. But you're absolutely right, Roland. That's why we won't see his tax return, because it's a blueprint for how to write off everything.
There you go. All right. That's Lynn Richardson. We certainly appreciate it. Thanks a lot.
Thank you.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honoré, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, Senior Economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is President of the National Medical Association, President of the American Medical Association, Dr. Patricia Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist. Dr. Georges Benjamin, executive director of the American Public Health Association. Malcolm Nance, family medicine physician, Dr. Jen Caudle. Dr. Tashaka Cunningham, a molecular biologist. Kat Stafford, she's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University. Congresswoman Yvette Clarke from the state of New York. William Spriggs, AFL-CIO economist. Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Braveboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she's a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. You spoke of Dr. Fauci. Let's talk about that. The White House is refusing to allow him to testify before the House Appropriations Committee regarding the coronavirus. They literally said today, nope, we'll figure out a time later for him to testify. Really, Rob?
Yeah, look, this is, to my friend Robert, I love him, but there are crazies on the left and on the right, but right now, the only crazies that are going with guns are crazies on the right. And the ones that are putting people at risk are the crazies on the right. And because they have a leader, to your point, Roland, that is willing to do anything. And I actually don't want to give him the benefit of the doubt. I think this is very strategic. I think he wants to go out there and rile people up, get people upset. He thinks it's the only thing he has to really help him win re-election because he was going to run on the economy, can't run on that. Certainly can't run on stable leadership. Certainly can't. So I don't know. The only thing he has is to make sure that he enrages his base and make them find up this made-up reason, where I do agree with Robert that he's trying to make up some conspiracy, but that's who the man is. He's been that way since the very beginning. So he's doing this with Dr. Fauci because he doesn't want to do anything that might make him look bad, but there's nothing he can do to prevent him from looking bad. He's a bad president. He's a bad leader. He just needs to go.
Kelly, look, he's already refused to allow so many other people from testifying. This is no shock at all. And so this is business as usual with this administration.
I mean, this entire administration for the past 4 years has proven how corrupt it is, how inept it is, how, frankly, dumb it is. So it's not surprising to me that basically the smartest person in the room right now, being Dr. Fauci, is prohibited from testifying. Just proves to me how I wish I could say I'm outraged or anything like that, but at this point I'm just jaded. And I'm ready for him to leave office. Hopefully it's in 2020. But we need to really just put politics aside at this moment and focus.
Actually, hold tight 1 second. I can barely. Hold on 1 second. I can barely hear you. Your signal is breaking up. Guys, y'all go ahead and get that fixed. I want to go back to Robert here. Robert, to again, this is what happens when you have no respect at all for another branch of government. That's what's going on here. To say Dr. Fauci can't testify is just ridiculous. It's just ridiculous.
Well, I think in addition to that, the problem that the administration has is that Fauci is not going to carry the party line. You can go back 20 years and see Fauci going back and forth with Obama when he was in the Senate. You can go back 30 years and see Dr. Fauci going back and forth with in the 80s on the AIDS epidemic. He is not a partisan individual. He's not going to buy into the party line. So they do not want him saying the scientific facts, which are hydrochloroquine is not going to save anybody. It does not work. That does not agree with the party line. We do not need to be opening the country back up without having a vaccine, without having a treatment, without having additional medical beds, without having the ability to handle a medical surge. Does not go with the party line. This is not going to be over the summer. What we've seen in equatorial regions and in the southern hemisphere is that warm weather does not seem to affect this the same way that affected MERS or SARS in the early 2000s, and we will still have an outbreak going into June, July, and August. That is not what the administration wants to hear, and that's why they don't want him to testify, because those medical facts, those scientific facts which exist, will ruin the justification for re-election and the concept that somehow this is just going to magically go away. We are stuck with this for a long time. There is no vaccine coming. There is no treatment coming down the pipelines that will magically save us. We are stuck doing this for the foreseeable future, that we can either accept that reality or we can ignore it and simply say we're fine for a couple 100,000 people a year dying from this. And I think many people on the right side of the aisle are okay with that.
Yeah, because they don't think it's going to be them. They think it's going to be somebody else. It won't be them. And I'll just say this to Robert's point, their whole talking points don't align with reality. They haven't for a while. Here's the thing. We just notice it now because everybody's lives are at stake. So, this president has never been in tune with reality. I think right now the right and those who defend Trump live in an alternate universe that has its own rules, has its own facts, has its own science that none of us understand, but is not aligned with reality. So no one who wants to tell the truth is going to be aligned with Trump. I say that unequivocally.
Every single night. We've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardy, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patal Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Springs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the group. The Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District Dr. Leon Madugal, President-elect of the National Medical Association, Jana Bailey, Mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Man, like, I'm still befuddled by this whole deal. When Trump stands there and says our job is to serve as a backstop, I mean, look. How crazy to have states competing against one another. Now you got Maryland Governor Larry Hogan, who's ordered gear to be hidden so it could not be snatched by the federal government. That's just stupid. States should not be bidding against one another. This is how you use this is how you use the power of the federal government to lead in this. And it shouldn't take a philanthropist giving away PPE equipment to hospitals and healthcare workers.
No, I don't think that any of these efforts should rely solely on that. I think it should be a collective effort on behalf of the federal government, states, private interests. I think that this is a global pandemic. And I'm not one of those, and I say this all the time, and people say, oh, well, why would you believe that? But just from the jump, I'm not one of those who believes that the federal government does everything, or really anything for that matter, perfectly. I can't think of an example. I can't cite a single example of something, not even of this magnitude, but when we've had other previous disasters. I can't think of an instance where the federal government has been pitch perfect in its response.
No. Hold on. First of all, there's a difference between saying something that is pitch perfect and then when you've had operational standards. No, there are examples. This is what FEMA does. There are examples where FEMA has come in with their people, with their systems, and being able to organize and set these things up. That has happened. This here is nonsensical. You have somebody who refused to properly use the National Defense Production Act. Said, I'm going to use it, then I'm not. Well, then I might use it, then I'm not. It was all over the place when, not as with ventilators, it was perfectly clear. We're going to need massive amounts of PPE. Then, let's not forget, this is the man who stood at the podium in a news conference and said that workers were basically stealing the equipment out the back door. That's what you're dealing with. So if that's your thinking, hell no, you're not going to be serious about trying to order more PPE.
Well, what you're talking about is a procurement issue. And at the end of the day, the president of the United States obviously is not in charge of the federal government's procurement.
Yes, he is. No. That's not true. Yes, he is. Okay, when you are hold up. When you say he's not in charge of it, there's a reason that Harry Truman had the buck stops here. You hired the people in place.
I was actually getting to that point, but you wanted to disagree with me before I even said it. But of course, at the end of the day, the buck stops with the president of the United States.
No, but you can't have both ways. You can't say they're not the procurement officer, but then the buck stops. No, that's what you are. You are a procurement officer. Yes, you are.
Roland, I mean, okay, I get it. This is the game that you would like to play.
No, it's not a game. Hell no. What you're not gonna do is tell me I'm playing a game when 71,000 Americans, microphone down, 71,000 Americans are dead. 71,000 Americans are dead, and we have somebody who accused healthcare workers of stealing equipment out of the back door. Kelly, that to me is what's shameful. And yes, we have systems designed for this, but you have somebody who doesn't want to use a system, who brings Jared Kushner in, who goes, oh, we're going to come up with a whole new system. And then, Kelly, we have people who, one guy, a Silicon Valley engineer, who sends Donald Trump a tweet, who the next day receives a $60 million PPE contract, and he's never done PPE.
I need to get over the fact that Malik just said that the president isn't in charge of procurement. That's really his job. But nevertheless, the fact that the notion is that, you know, federal government shouldn't be the sole source of anything that this country does, you can argue here or there with that. There are solid arguments on both sides, the main one being that we pay taxes for this to happen. But at the same time, even if you don't agree that they should be responsible for all of it, it is our government's job to take initiative of it. And our government right now is so behind the ball on this that we have philanthropists that we are looking to ahead of our own government, ahead of our own president, to actually receive guidance on how we should get this done. That is shameful. We should not have a Bill Gates, you know, taking precedence over what our president says regarding this issue. We should not rely on a Bloomberg or even the guy that you just had on the show, relying on them for PPE and guidance and referrals and the like on a global pandemic affecting this country when they don't have a role in the government regarding this country. Our president has that role. Our administration underneath the president has that role. And guess what they've done? They've done nothing. They have done absolutely nothing that takes initiative. I'm not saying they've done absolutely nothing at all over the past couple months, but all things considered, they have been playing defense on this issue, and very poor defense, I might add. Everybody else, these philanthropists and other countries that have been helping us, Maryland had to commission South Korea to bring us something that our federal government had the money to give the state. That is abysmal. That is shameful.
Brooke,
that is absolutely shameful.
Brooke, I simply cannot accept the idea where workers are having to buy, healthcare workers are having to buy their own equipment. I can't accept this notion of governors stating how the equipment that, first of all, what Donald Trump said, y'all got to order your own. And then when they ordered their own, the federal government was seizing it. Now, Miller can sit here and say, well, not a procurement. Here's the deal. Is Donald Trump literally sitting in the Oval Office stamping procurement orders? No. But you damn sure hire the people who do. You damn sure put them in place. And if they are sitting here not doing the job, but guess what? Maybe they're not doing the job, Brooke, because the person who's at the top of the food chain is so clueless on this that he's not sure what in the hell he wants to do. It's like, oh, I mean, I will not forget Donald Trump standing before the camera telling the media, y'all should look into this. I mean, why do they need so much equipment? Is it going out the back door? These are people who are putting their lives on the line, and this idiot is standing in front of the cameras accusing them essentially of stealing equipment, bro.
You also remember he was willing to be very helpful to red state governors. It was essentially like, if you don't speak to me, if you don't interact with me, or if you don't talk about me when I'm not around in a way that I feel flatters me, you're on your own. And I do like that it was pointed out earlier that the federal government is funded by the people that it's supposed to protect. We're in the middle of a worldwide pandemic. We're in the middle of a pandemic. I just can't accept the answer whatsoever that anything is simply just not the president's responsibility, because all of this is.
So moving
forward. And he's willing to take the responsibility when it comes to helping governors that he likes just said, like, he said, like, in not so many words, that, like, if you aren't someone that interacts with me in a way that I like, the healthcare providers in your state have to suffer.
So moving forward, Malik, are we going to continue seeing states fighting with one another, actually having to outbid one another? The federal government could have stepped in and said to companies, no, PPEs normally cost $5. You're charging 15, 20, 25? Hell no. That's the point of the National Defense Production Act, to keep the price gouging from happening. We have governors who have said they were ready to place an order, and then they say, oh, no, we got one state, they're going to pay 10. Oh, they're going to pay 12. Oh, they're going to pay 15. They're going to pay 20. And states were sitting here bidding against one another. So what the hell is Trump supposed to be doing? Is he not supposed to stop that from happening? Or is this all about make as much money as you want to, and I'm not going to care about the citizens and the taxpayers of the country? It's a free-for-all. So which one is it, Malik?
I think you're right. That that is a great example of using the defense the defense authorization. I think that's a good example.
So what did he do? So why didn't your guy do it?
Okay, well, from what Attorney General Barr said from the podium, and I think he's spoken on it twice now, he's talked about what the federal government was doing in response to things not just like price gouging, but even hoarding. I didn't realize that hoarding was actually an issue, but apparently it is too. So he's talking about the steps that the DOJ has taken to address things like that. So while those things may not have been in place initially in the federal government's response, these things are in place now. Some of these things, it's taken a while for states to catch up.
So it never occurred to you. It never occurred to you that when you're in the middle of an emergency, that there are going to be people who are going to slap high prices. It never occurred to you. See, if FEMA is involved, FEMA is used to that. I've lived through 3 hurricanes. We all know the deal. What happens when hotels, a room that's normally $89, all of a sudden is $289 after a hurricane. And the state comes in and says, no, drop all prices or we're throwing your ass in jail. There were some people in Texas after the last hurricane. And what they did was they were gouging county governments. Oh, we're going to charge this much money to haul trash and haul debris out. State found out. State said, we're throwing all y'all asses in jail for price gouging, lower the prices. They did. Donald Trump hasn't done that.
Well, maybe I'm not understanding what you're talking about.
You probably aren't.
Versus what Attorney General Barr said from the podium. I mean, this is what he said himself. I mean, maybe he's lying, but this is what he said himself.
I'm sorry. Did you said Attorney General Barr lying? Yeah, we kind of used to that.
Well, I'm just telling you what he said. I mean, I can only go with what he said. And what he said is that the DOJ was actively involved in efforts to make sure that they're addressing things like price gouging and hoarding. He said this from the podium at least twice now. So it's not accurate to say that the federal government is not focusing on these things. Yes, there are things that the federal government should have done from the beginning, but there are things that they've done well since then. And understandably, people don't give them the credit for those lost weeks or 3 weeks that people generally talk about. Well, but there are things that the federal government is definitely doing, and I will just.
Well, first of all, you don't give credit for 3 lost weeks. You don't give credit for that.
Yeah, but if your suggestion is that we ignore everything that comes outside of those 3 weeks, then I just disagree with that.
Well, how about this here? Okay, so fine. So fine. Beyond those 3 weeks, then you've explained to me how in the hell a Silicon Valley engineer could send a tweet to Donald Trump one night and the next day is awarded a $60 million PPE contract when the Silicon Valley person has never, ever before done PPE. Please, by all means, explain that one to me.
Well, I don't know how the contracting and procurement worked in that particular situation.
Hold on. Let me say it again. A Silicon Valley engineer sends a
tweet. With a lot of money.
Sends a tweet directly to Donald Trump. The next day, that company is ordered, give them a $60 million contract.
Yeah, you probably have to talk to someone more familiar than that.
I probably have to talk to somebody more familiar.
But I do. As far as the federal government's response, I mean, I can talk about what the federal government's response.
No, that's not what I asked you about. What I'm trying to explain to you, Malik, is I don't want to hear the federal government spin. The problem is this here. No. The problem is this here. First of all, when you have people who this is what they are supposed to do, and you leave competent people in place and you don't replace them with incompetent people, then you're able to do the job. But when you put the person in the Health and Human Services Department over the coronavirus deal, who used to be, I'm sorry, what was he, Brooke? A dog walker? A dog trainer?
Secretary Azar?
No, the person Azar put in charge, who was a dog trainer? Wow, that's the expertise to put in charge of an international pandemic.
Yeah, I'm surprised the Senate would confirm someone.
No, that job is that's not a Senate confirmed job. That's the job that Azar put on. But that's what happens when you have incompetence in this administration. All right, folks. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patal Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Springs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the group. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. All right, folks. Today's White House coronavirus news conference lasted just 21 minutes, the shortest any of the latest news conferences. Donald Trump didn't take any questions from reporters. I wonder why. Could it be because he made himself look like a total clueless ass yesterday? Well, watch this.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me. So we'll see. But the whole concept of the light, the way it kills it in 1 minute, that's pretty powerful.
Like my man D-Nice says in Club Quarantine, run that back.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me. So we'll see. But the whole concept of the light, the way it kills it in 1 minute, that's pretty powerful.
RB, y'all, the makers of Lysol, had to put out a statement saying, don't do that. Don't do that. Quote, due to recent speculation and social media activity, RB, the makers of Lysol and Dettol, has been asked whether internal administration of disinfectants may be appropriate for investigation or use as a treatment for coronavirus. As a global leader in health and hygiene products, we must be clear that under no circumstances should our disinfectant products be administered into the human body through injection, ingestion, or any other route. As with all products, our disinfectant and hygiene products should only be used as intended and in line with usage guidelines. Please read the label and safety information. Joining us is Dr. Ebony J. Hilton, Associate Professor of Anesthesiology and Critical Care Medicine at the University of Virginia. So yesterday, folks, while we were live on Roland Martin Unfiltered, Ebony starts sending me text messages. She said she was hot. What was the phrase, the country phrase you use?
I was 38 hot. But in all fairness, I didn't know what the actual translation for 38 hot meant. But even in reading on Urban Dictionary what it means, it still applies. I was just mad. We shouldn't even have to discuss this. Who would ever think we would be discussing why you should not inject Clorox or Lysol or Joy detergent or any of the above in order to keep your insides clean? That's not how this works. It never has. It never has.
Right, but it shows you. Okay, first of all, and I love this here. If y'all have the video, go ahead and play it. So today he goes, oh, I was being sarcastic.
Right.
I was being sarcastic to a reporter. No, he wasn't.
We saw it.
He looked he sounded like a dumbass, and everybody ripped him. Now you got conservative media trying to, no. He was taken out of context, and it was, in fact, Kayleigh McEnany, let me see if I can find it. Kayleigh McEnany, the press secretary, she comes out and says, it was taken out of context, yet Trump had already said, I was being sarcastic. So which is it? Then, Ebony, he looks over to Dr. Birx and the other people, and then they actually are trying to make sense. At some point, they should say, man, hell no. That's crazy.
And it's one of those things for Dr. Fauci and Dr. Birx and Dr. Adams, the Surgeon General. We took an oath to first do no harm. And when you hear something, to not speak up is also doing harm. So I am not going to let them off the hook. you need to speak up. And if it means you get fired, so be it. Fire me, and then I can hold a press conference at the same time. You're going to hold your press conference every day too. But what I cannot allow is for you to sit here and use this platform that's supposed to be to empower the American people, and instead it be used as a way that we can literally kill American people if they follow your words. It is negligent, and people need to start remembering what the underneath title is, besides being in the CDC and working under President Trump. You took an oath to be a doctor first. Do that.
Right, and this is in fact. Okay, I'm about to play this video here. So what they did was they actually zoomed in. They zoomed in on Dr. Burke's face. So I'm going to play it right now as Trump was talking, and it's just hilarious. It's hilarious because she's sitting there like, what the hell is he? Then she takes this deep breath and she puts it. She's like, what the hell is he talking about? I gotta sit here and listen to this. I gotta listen to this. What in the hell is going on? Evan, explain it. I mean, this is, I just don't understand why they don't want to hurt his feelings. Oh, he's the president. No, this idiot is just, I'm not a doctor, but I'm really smart about these things. No, he just up there just throwing out any stupidity.
My mama used to tell us, if you didn't open your mouth, people wouldn't know how stupid you are. And that's the type of information I would like to pass on to President Trump. If you didn't speak so much, people would have no clue that that type of thought process would actually go through your mind. And so holding these press conferences is actually probably hurting you worse than anything else in your terms of reelection. Because if anybody can elect someone that says that they think they can inject sunlight into your veins or inside of your body some type of way and to help your lungs be better, then we might need some type of test before you can vote. I mean, this has gotten to a point where it's actually ridiculous, and past the point of ridiculous is dangerous.
And then says, hey, I want y'all to test that. They're like, man, we not about to test no damn disinfectant in the body.
I'm ready for somebody to flip a table. Or I'm not flip a table. I'm at least ready for someone to walk out, to say, that is not true, that's a lie, and walk out. Because again, we know that and now whether or not this person followed protocol to true form, but when President Trump was touting about hydroxychloroquine, and it was a man who decided to take aquarium treatment medicine, or aquarium treatment, as was a cleaner that had the chloroquine in the ingredients list, and he died. And we're seeing now where the FDA had to release a statement saying, even for those who can get hydroxychloroquine in the medical form, we are not advocating that you take this at home in order to prevent COVID-19 infection. We know it has side effects. And in fact, there was a study that was just released out of the University of Virginia, where I work, where we looked at veterans at the VA hospital. And what we saw was that you actually had worse outcomes with use of hydroxychloroquine. So this is not a medicine that you can just take. It has some real serious side effects that we need to look and see. What's your past medical history? What other diseases do you have? What medications are you on? And how does it interact with those specifics of your body? So he needs to just stop. And I don't even know what subject he can stick to, but it's not that one.
And not only that, now, of course, the FDA is issuing warnings against this anti-malaria drug. Now we also know that a so-called quack out of Florida who came up with this bleaching crap sent Trump a letter this week. I mean, this dude is literally listening to quacks who are sending him letters, and he just goes out and spouts it out in front of the American people. And then he kept pushing the FDA. Now we know that he basically fired a doctor who did not want to move forward with this particular drug. Oh, Laura Ingraham and Sean Hannity, who kept touting the drug. Now it's been almost 2 weeks since they even mentioned the drug. And so these games that people were playing, and so now all of a sudden, Trump won't even mention the drug after he was touting it every single day.
Mm-hmm. And in the meantime, we have Americans dying. And it's not just old people, we have babies. I'm sure you saw the report of the little baby that just died.
4-month-old.
Had a 5-year-old little child that just died. And how is this being allowed to happen every day? And so if you follow me on Twitter, you'll see that I pretty much post every day, when is the 25th going to be called on this? Because it comes a certain point in time where partisanship has to fall at the wayside when American lives are being cost. And we are seeing overnight 2,600 people died in America. Right now, we have upwards of 1,500 that have died. And we have still another 6 hours to go, and not all the states have actually reported their cases for today. And so we are very much still in the midst of this pandemic. We have people listening to him about medications. We have people holding rallies and going outside to protest having to stay inside, which is the most privileged thing I've ever heard. And at the same time, in the last 5 days, we've increased our cases by 100,000 cases, and we've increased our deaths by more than 10,000 deaths. What is going to be enough for us as far as Americans? We, the people, we own this country. We should own this country. When are we going to say it's enough? That we don't want to die, and we want someone that we can actually trust to give us the information, not someone who makes up stuff literally as he breathes.
Okay, and then of course, we were treated today to these idiots protesting in Wisconsin because of the shelter-at-home rules. They are mad and upset. I'm going to play this video in just a second. This was some of the video that was shot on the streets there that people were posting. Again, people on the corners, at the state capitol, out there protesting, mad and upset. And you swear these people aren't paying any attention to 51,000 dead. And do they think they can't get it?
It's one of those things. I actually don't know. I think people know they can get it. I saw this interview where a guy was saying that he's immunosuppressed and he knows that he's at risk, but he's still out there to protest his liberty. And another lady had, give me liberty or give me death. And I was like, that's kind of ironic, because right now you may get your wish for both of those, in that you are not respecting the fact that this virus does not care if you live in a democracy or in a dictatorship. This virus cares about taking over your body so that it can live. And people are dying. In Wisconsin, for instance, today alone, they've had 5 people die, 262 people die altogether. They've had an additional 300 cases that's been reported. And that's with us not testing. And I have to say that over and over again, because people keep on making these predictions of when the peak and what model and whether or not their state is safe to open, where in Wisconsin, for instance, they've only tested 10,000 people per every 1 million citizen. You haven't tested enough. So you have nothing to stand on to say whether or not your state is safe to open. And people have to realize that it takes one moment and you are gone forever.
Well, and that's really what you're dealing with here. You're dealing with people who are, again, they're getting their instructions from Donald Trump. They're getting it from these crazy conservative radio talk show hosts who believe that we've gone too far. And so what they want to do is say, okay, forget stay-at-home orders. There's no reason we should be doing all of this. And look, Ebony, I'm telling you right now, Doc, I keep telling black people, let them go out there. Y'all want to kill you? Go right ahead. Look, I'm not interested in trying to run out to these fools. I ain't trying to be in no bowling alley, no movie theater. They can keep all that they want to. Look, I love the Lord. I'm not trying to go to a church where you're going to have 2, 3, 4, 500, 1,000, 2,000 people sitting in the church, because we still do not have a handle on this. And I don't care what Donald Trump says, ain't buying it.
And it's one of those things, particularly for Black people. we are dying at higher rates. And yes, is it because of systemic racism and the predisposition that we now have towards these chronic illnesses? Yes. Is it because we have these industries in our communities that's causing our children to grow up with asthma? And is it because we have these food deserts, it's food apartheid, where we're not getting adequate healthy food options in our communities, and it's causing increased hypertension and our high blood pressure and diabetes? Yes. Is it because there's no sidewalks in our community and it increases the risk of obesity? It's an independent risk factor for obesity. Yes. But that doesn't take away from the fact, just because it is a targeted thing that is not right and that we must fix, it doesn't take away from the fact that if you get the coronavirus, your chances of dying are increased. And it doesn't take away from the fact that currently upwards of 70% of all those who have passed away have been Black and brown. So that being the case, I don't care what bowling alley is open. You keep your, you know what, at the house. And stay where you're safe, because your family, your community, your nation needs you. But we need you. Your life matters. You know, we say Black Lives Matter. Let's prove it. Stay at home.
Right. Well, first of all, Dr. Ebony, you got to remember, Dr. Ebony, this is Roland Martin Unfiltered. What you want to say is, keep your ass at home.
But my grandma watching. Hey, Grandma Louise. My grandma.
Yeah, you know your grandma. You know your grandma saying the same thing.
Right. Listen, she told us that we best not be in the streets. And it's true. But it is one of those things, like I said, this is taking our babies. When I saw the picture of the little 5-year-old girl, I said, you know, I think about my niece who's 4 years old. There's no way I would be able to forgive myself if I didn't say every single day that this is nothing to play with. This is not a conspiracy theory. This is not G5 or whatever else the new thing is as far as these conspiracy theories. This isn't something that you can shine sunshine into your throat and hope that it goes away. This is a virus. It's called the coronavirus, COVID-19. It was first discovered in China on November 17th, and it's going to be here for a while. We do not have a vaccine, and even if we had a vaccine, it still does not preclude that you could still die from it, because as we see with the flu vaccine, it still kills people too. So in this time, until we can figure out a better way to treat you, stay at home so we won't have to, because we need you to be alive by Christmas. And that's my only mission, is to get people to see the holidays. That's it.
Well, we certainly appreciate all the work you have done. Folks, Dr. Ebony Jade Hilton, she is Associate Professor of Anesthesiology and Critical Care Medicine at the University of Virginia. We appreciate it. Thanks a lot.
Thank you. Thank you. Y'all have a good one.
All right, folks. Every single night, we've got some of the top Black experts. You're not going to see them on cable news or broadcast news, because you swear Black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first Black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Springs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Braveboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist College. Principal Steve Perry of Capital Prep. Health and Wellness Specialist Dr. Yolanda Hancock. Desmond Meade, President of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the group. Lamina McWhorter, founder of Love by the Hand. Dr. Julian Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. All right, I want to bring in right now, folks, Congressman Dwight Evans from Pennsylvania. He joins us at Roland Martin Unfiltered. Congressman, how you doing?
Oh, good. How you doing, Roland?
First and foremost, when you see what's happening there in Michigan, we've seen in Wisconsin and other places. I mean, these are the people who are part of the Tea Party. These are the people who say they love America, but they have these militias. They're brandishing their guns. Look, let's just cut to the chase. You know, if these were black folks sitting there brandishing these guns, it'd be a whole hell of a different reaction in this country. I mean, it has to bother you that you have Donald Trump who incites these people and gets these people out there by saying liberate these states.
Well, you're absolutely right, Roland. And it's the fact of the matter is why, as one member of the Congressional Black Caucus, we're very much determined to carry our message about safety, about health, about employment, and in terms of black folks, under Karen Bass's leadership as chairperson of the Congressional Black Caucus, that's just what we've been doing. We've been having all types of town meetings, all types of discussions, raising the consciousness. As you know, the Congressional Black Caucus is the conscience of the Congress. And in spite of this pandemic that we have, we are still fighting. Believe me, we're at it every single day, and we don't take anything for granted. For example, in terms of small business, we recognize that the first time it wasn't getting to the mom and pop, wasn't getting to small businesses. So we went out and got changes done in terms of CDFIs, credit unions, minority deposit. We wanted to target. We got set aside. So look, it's not easy, but we're not giving up. We know, we understand that we have to keep fighting at this every single day. And we recognize that we're in a struggle. We recognize that, and we know we're in a struggle. So all the things you've been describing, we understand it, we see it, and we're working at it. All 55 members are making that kind of commitment, no matter where they are across this country. Every member of the Congressional Black Caucus realized the challenge we're in.
One of the things that we talked about to open the show, Senator Kamala Harris wants, in terms of how we look at this particular data, producing a bill as well. You also talked about targeted testing. Will we see that? Look, it's clear we're not going to get any real direction from Donald Trump. He wants to leave this up to the states. He doesn't want any responsibility whatsoever. And so are we going to see that in Pennsylvania? Are we going to see that in other states?
Well, believe me, we're using all influences and leverage that we have. Here in Pennsylvania, the governor and the mayor of the city of Philadelphia, I raised that issue with them because of the fact of the matter, the health disparities that we're seeing are not new. This is not new. The pandemic just shows it even more. So the reality of it is we're still fighting that. When the senator from California came out with that particular bill. She's fighting from a national perspective. I'm fighting from the perspective of a local level. We have to constantly raise it. And this is an issue that in the Congressional Black Caucus, Barbara Lee from California, we got $25 billion in terms of testing. Now, that wasn't in there, but the Congressional Black Caucus drove the issue about the need for testing. As you know, I've talked about universal testing. In Los Angeles, they came out today and talked about the option of testing for everyone. Los Angeles is a major city, one of the first cities that came out. Roland, I'm not telling you, because you've been around, it's going to take that kind of struggle, and we're going to have to hit it from every single level, from the Senator Harris in California, Barbara Lee in California, Karen Bass, matter of fact, Los Angeles, California, me here in Pennsylvania. That's the kind of struggle we're in. So this is not for the faint-hearted. This is not to be given up. And our people understand a protracted battle. And that's just what it is. I'm not telling you anything or your listening audience anything different that you don't know about the struggle it's going to take. And we're going to have to hit it every way we can.
All right, then. Congressman Dwight Evans, we certainly appreciate it, sir. Thank you very much.
Thank you.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardy, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Braveboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon McDougall, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered. Folks, we keep talking about again where we stand on this issue. A little bit later, we're going to talk with someone out in California who's talking about what they're doing for black businesses. That's critically important. I told you last week about Facebook, and one of the things that Facebook is doing, Google is providing media grants. Facebook is also providing grants to small businesses. And so there was a deadline that was involved for their particular grants. I'm going to try to, y'all have it? That's the actual website right there. That's the website you see right there, facebook.com/business/boost/grants. And so that's the site. I'm pulling up. This is what the site looks like. It's this small business grants program. That's what it is. Go ahead and keep the website up as well. Small Business Grants Program. And so they're helping folks. So here's the deal. They have various dates on here depending upon where you are based. And so go to this website, facebook.com/business/boost/grants in order for you to apply, and so we certainly want y'all to do so. So many people out there are trying to help businesses survive. The reality is, when you talk about businesses, you look. I'm wearing the T-shirt Black Owned. First of all, the company that gave me this sweatshirt, they gave it to me last year. I need y'all to send me an email, a tweet, or a post on Instagram, so I can give y'all a shout out. People keep asking me where did I get it, and I totally forgot. And so, so send me that. So there's so many businesses that are out here. The reality is, people who work for those businesses, they've got children. They're paying mortgages. They're paying college tuition. They are taking care of children as well. And so our businesses are being greatly impacted. We had John Hope Bryan on talking about this process to get the federal funds last week. Go to our YouTube channel. You missed that great conversation. He gave some great information. But we got folks who are impacting right now, who are laying off people, like literally right now. I talked to several people today who've been laid off from their companies. Well, Jay King, he's the CEO and president of the California Black Chamber of Commerce. They recently announced the launch of a special COVID-19 GoFundMe campaign to financially assist and save small black businesses in California. They are the largest African-American nonprofit business organization that represents thousands of small and emerging businesses. The organization is concerned that the $2 trillion COVID-19 stimulus bill will overlook small businesses. And of course, we had Congresswoman Sheila Jackson Lee on at the top of the show, Jay, and she was talking about what they are doing to fight for black businesses. I told her about, of course, Shake Shack, large restaurant chain. They got $10 million. We now know that between them, Ruth Chris Steakhouse got $20 million. Potbelly got several million. These large chains, and we only know this because they're publicly traded companies. They had to disclose it. And so what about your large private companies? They got the money as well. And so too many small mom and pops are being left out. What are you hearing from them in California?
Well, we're hearing that, they're getting letters that say that they're not, basically they don't qualify. We got to remember that 95% of African-American businesses across the country, and surely in the state of California, are they're single owners. They don't have any employees. Yeah. 95% of our businesses are without employees, so oftentimes they don't even qualify for the programs that's in front of them.
Well, first of all, in fact, nationally, there are 2.6 million black-owned businesses. To your point, 2.5 million have one employee.
Right.
Only 100,000 black businesses in America have more than one employee. Go ahead, Jay.
That's right. So we started getting calls, not just on the weekdays, but on the weekends. People didn't know how to fill out the SBA loan application. And right now, Wells Fargo was being sued because they shuffled the paperwork. In other words, companies that were large companies where they could get bigger fees for doing their paperwork, they moved them to the front of the line. So a lot, even when you did all the things that you were supposed to do the right way, you got pushed back. Now, let me say this, Roland, I'm not surprised. And this is a history of this country. So as Black folk, we spend between 1.2 and 1.5 trillion dollars a year. We're recorded as the number 9 to number 11 economy in the world. So it's not like we don't have money.
Right.
We have to now start becoming responsible to us and for us. We have to become more financially literate, and we have to start looking for, especially now, we have to look out for African-American small business owners. There's one thing to say we support them and we love them. Look, you're wearing a shirt by an African-American designer. I'm wearing a shirt by an African-American designer here in Sacramento. I'm wearing glasses by an African-American eyeglass business owner, because I know what it takes for our businesses to stay in business.
Right.
But now we have to start putting our money where our mouth is. So what I'm saying to 2.3 million African Americans in California is just put $5 on it. If we all put up $5, we'd raise $11.5 million for African American small business owners. Now I'm getting some pushback from white folks that come on my website, on the California Black Chamber website, saying, "How can you do this? What if we started a white man fund?" And I wrote back, I wouldn't be offended by it. I believe they already have a white man fund. It's called the SBA. But if they did,
right.
I think
right. It's called the American Banking Institution.
Absolutely.
It's called Silicon Valley. It's called venture capitalist.
Right. So you can't get offended by me for calling on my own community to support itself. And we should do that. And so I'm saying to people, look, go to GoFundMe and put in everybody pitch in. Just type that in the search engine and put $5 in.
Got it.
We raised about $6,600. Look, Roland, I found out about your program. Today I made a contribution, and I'm going to make a contribution every week because I think it's one of the most important programs on social media. Whether we agree at 100% or not ain't the issue for me. Mm-hmm. The fact that an African-American man or woman is out here putting information into our community, we have to start taking responsibility for us. I'm tough on us. I'm tough on my community here in Sacramento. We own a radio station, 97.5 KDE. Mm-hmm. We're probably a community active radio station in the country. I put out a mission in Sacramento for 1,000 African-American people to put $100 a month into a community investment fund so we can buy back our community in North Sacramento, Del Paso Heights.
Right.
And I said, we're not going to just do it here. We're going to do it across the city and then across the state. And we should be doing it across the country. What we're doing in California, every African-American state chamber president should say, this is what we're going to do in our state. And not only so, as a state chamber president, my job is to start it. But I have other presidents across the state that are local presidents. We'll get the money to them. It's their job to get it to their community.
Folks, go to
They're going to know where the money went. Everybody's going to know, where this money is. Yep.